Hello and welcome to a discussion on the blood supply of the pelvis as well as the innervation of the pelvis. Right. So if you remember from your abdominal anatomy, the abdominal aorta was going to divide at the level of L4 into the common iliac arteries as well as a median sacral artery. The common iliac arteries would divide at the pelvic brim into the external iliac as well as the internal iliac. The internal iliac being the smaller one, and the artery of the pelvis, as well as the perineum through its pudendal branch, the internal one. The external iliac travels lateral to the superior pubic ramus, and it's going to give branches for the anterior abdominal wall before it travels deep or passes deep to the inguinal ligament and become the femoral artery. The branches are going to be the deep circumflex iliac and the inferior epigastric arteries in that region. Right. Then the internal iliac would be the true artery of the pelvis. And this internal iliac is going to pass to the upper margin of the greater sciatic foramen, where it then divides into an anterior and a posterior division. The mnemonic for the branches of the internal iliac would be, I love going places in my very own underwear. The first three letters would be the branches that are actually going to be coming from the posterior division. Branches from the anterior division will include the umbilical artery, which normally should obliterate, but the persistent proximal part of this umbilical artery gives off the superior vesical artery. Right. The superior vesical artery can also be formed as a direct branch of the internal iliac artery. From its name, it's going to supply the superior aspects of the bladder, and it's also going to supply the lower third of the ureter. If you remember the blood supply of the ureter, the upper third would get blood from the renal arteries, the middle third would get blood from the gonadal arteries. Then there's the obturator artery, which passes along the lateral walls of the pelvis in company of the obturator nerve as well as the vein. They're going to leave the pelvis through the obturator canal, which is a small gap left in the obturator foramen after it's closed by the obturator membrane. It's going to supply the pelvic muscles, the ilium, the femoral head via a small branch that travels in the ligament of the head, which then becomes a vestigial structure in adulthood. And that obturator artery, after it passes through the obturator canal, it gains access to the medial thigh, where it gives blood supply to the muscles of that compartment, and it's going to be helped by the medial and the lateral femoral circumflex arteries, which are branches of the profunda femoris, which comes from the femoral artery. Then there's the inferior vesical artery in the male, and the female, it is analogous to the vaginal artery actually. This inferior vesicle will supply the urinary bladder. It also gives blood supply to the prostate. It also gives blood supply to the seminal vesicles. In other instances, it gives off an artery to the vas deferens, which can also be given off from the umbilical artery. Then there's the uterine artery in the female. The uterine artery is actually on the floor of the pelvis, and it runs along the root of the broad ligament, and it's going to cross the ureter superiorly, where those who like mnemonics would say water under the bridge. The ureter is the one that is below, which is carrying the urine from the kidneys towards the bladder. The uterine artery will supply the uterus. It will also give blood supply to the vagina via a vaginal branch of the uterine artery. Then there's the internal pudendal, which is the principal artery of the perineum. It's going to leave the pelvis via the greater sciatic foramen, loops around the ischial spine, then enters the perineum via the lesser sciatic foramen, and it's going to gain access into the pudendal canal, which is actually going to be located in the lateral wall of the iliac fossa. And within that, it gives branches, particularly the inferior rectal vessels, which are going to cross the iliac fossa. Then you have posterior scrotal arteries, the artery of the bulb, the deep artery of the penis, the dorsal artery of the penis, and all these arteries in the female, you simply replace the word penis with clitoris, which is basically what this slide here is now saying. Then you have inferior gluteal artery. The inferior gluteal artery is the largest branch of the internal iliac from its anterior division. This inferior gluteal will pass between ventral rami of S1 and S2, unlike the superior gluteal that we're going to see on the posterior division, which passes between ventral ramus of S1 and the lumbosacral trunk. It supplies the coccygeus, the levator ani, the piriformis, the quadratus femoris, the gluteus maximus, the sciatic nerve, as well as giving off branches to the uppermost part of the posterior thigh. You also get the mid-rectal artery. The mid-rectal artery will supply the lower rectum as well as the seminal vesicles in the male, as well as the prostate in the male. In other instances, this mid-rectal artery will be a branch of the inferior vesical artery. Then the posterior division gives off the iliolumbar artery. The iliolumbar artery crosses the sacroiliac joint, and it supplies the psoas major, the iliacus, the quadratus lumborum, which were basically muscles on the posterior abdominal wall. It also gives blood supply to the chorda equina, the spinal cord, which simply resembles the tail of a horse, and it's the lower parts of the nerves of the spinal cord, which are traveling to the sacral region and the coccygeal region. We also get the lateral sacral artery. There are usually two. You have an upper and a lower. They'll supply the piriformis. They'll supply the erector spinae muscle, which is one of the deep muscles of the back, classically classified as a deep superficial muscle of the back. Then you have the superior gluteal artery, which will exit the pelvis via the upper part of the greater sciatic foramen superior to the piriformis, which divides the greater sciatic foramen into an upper part and a lower part. This artery will give blood supply to the piriformis. It will also give blood supply to the gluteus muscles as well as the tensor fascia lata. And remember, I said it's going to pass between the lumbosacral trunk and the ventral rami of S1. So as a recap, branches from the posterior division, iliolumbar artery, superior gluteal artery, lateral sacral arteries. Then the rest will come from the anterior division. Then we also have branches from the abdominal aorta, which are going to the pelvis. There's the testicular artery, which will supply the middle third of the ureter, then travel inside the spermatic cord to supply the testes. The female counterpart will be the ovarian artery, which will also supply the middle third of the ureter, travels inferiorly over the pelvic brim to the ovary on the lateral pelvic wall, then gain access to the ovary via the suspensory ligament of the ovary, which connects the ovary to the lateral pelvic wall. Right. And it also gives blood supply to the lateral 1/3 of the uterine tube. Right. Then you have the inferior mesenteric, which you remember from your abdomen. It would continue as the superior rectal artery. Right. And this superior rectal artery will give blood supply to the rectum, and it travels over the left common iliac vessels to gain access into the pelvis. It's going to end by anastomosing with the middle and the inferior rectal arteries. Then there's the median sacral artery, which arises from the back of the aorta, and it travels all the way to the coccyx, and in other instances, it gives blood supply to the bladder. And the veins are mostly analogous to the arteries. However, remember there's the Parasympathetic plexus inside the spermatic cord, which at the deep inguinal ring, it would then become the testicular vein, right? Then there's the internal rectal venous plexus and the external rectal venous plexus, which I'd want you to remember from a perspective of the hemorrhoids. Internal hemorrhoids, you have prolapse of the mucosa that contains the internal rectal venous plexus, and they're painful, as well as you're going to see an impeded blood flow, and the veins would dilate. Then external hemorrhoids are produced by blood clots in the external rectal venous plexus, and you have bulging of the skin and the mucosa onto the outside. Then straight to the innervation. But before I get to the innervation, as a summary for the lymphatic vessels, you have the internal iliac lymph nodes, which follow the internal iliac artery, and they receive lymph from the pelvic contents, as well as some deeper structures of the perineum, the gluteal region, the thigh, right? And they will drain to the common iliac nodes. You also expect some sacral lymph nodes. Right? Then if you look at the innervation of the pelvis, it's customary to divide it into somatic as well as visceral. Right? The somatic nerves can be looked at under the sacral plexus, the coccygeal plexus, and the lumbosacral trunk. The sacral plexus is ventral rami of L4, L5, S1, S2, S3. In other instances, other books use S4. Right? And the sacral plexus lies in front of the piriformis, which is on the posterior pelvic wall, but behind or posterior to the rectum. It is nerves that arise from its roots, which are going to be muscular branches to the piriformis, as well as the levator ani and the coccygeus. Then you also have the pelvic splanchnic nerves arising from its roots. The pelvic splanchnic nerves will be the nervi erigentus. I'll mention them with the visceral nerves. Then branches arising from the dorsal surface of the plexus, you have superior gluteal nerve. It's going to be L4, L5, S1. It will give innervation rather to the gluteus medius and the minimus. Then you have inferior gluteal nerve, which is L5, S1, S2. It will give innervation to your gluteus maximus muscle. Right. Then also from the dorsal surface, you expect to have perforating cutaneous nerve, which is S2, S3. Then you also expect posterior cutaneous nerve of the thigh, which is self-explanatory, S1, S2, S3. Right. Then from the pelvic surface of the plexus, or the anterior aspect of it, we expect the nerve to the quadratus femoris, which is L4, L5, S1. It will also give innervation to the gemelli inferior. Then you also expect the nerve to the opular internus, L5, S1, S2, which will also give innervation to the gemelli superior. Then I mentioned the nerve to the piriformis as a branch from the roots, as well as the nerve to the levator ani and the coccygeus. Then the terminal branches, you have the pudendal nerve, which is S2 to S4. That is going to be the principal nerve of the perineum. Then you have the sciatic nerve, which has a tibial portion and a common peroneal portion. It's going to innervate everything below the knee, except the skin on the medial leg and the medial foot, all the way to the ball of the big toe. Then we have the coccygeal plexus. Coccygeal plexus is a small nerve plexus which is formed from S4, S5, as well as the coccygeal nerve. It lies on the coccygeus muscle, and it supplies coccygeus, the muscle, as well as part of the levator ani, right? And it's going to pierce the coccygeus muscle, and it will also supply the skin from the coccyx to the anus via the anococcygeal nerve. Then there's the lumbosacral trunk. Then there's the lumbar plexus, which is going to be ventral rami L1 to L4, plus or minus T12. From this lumbar plexus, we get an ilioinguinal nerve, which will supply the anterior aspect of the scrotum. Then if you remember the innervation of the scrotum, you'd say that the anterior aspect of the scrotum would have ilioinguinal nerve as well as the genital branch of the genitofemoral nerve, which was L1, L2, and arising from the anterior aspect of the psoas major, right? So those two nerves actually come from the lumbar plexus and they'll supply the anterior aspect of the scrotum. For the female, they'll supply the anterior aspect of the labia majors. The posterior aspects will be innervated by the posterior cutaneous nerve of the thigh, as well as the perineal branch of the pudendal nerve, right? Then for the visceral nerves, you're going to have the sympathetic trunk. They are the lumbar splanchnic nerves, which are basically L1, L2, right? And those nerves, they will give innervation to pelvic structures in terms of sympathetic, right? And remember the sacral sympathetic trunk, you have a right and a left, and they descend into the thorax between the bodies of the sacral vertebra and the pelvic sacral foramina, right? And inferiorly, those sympathetic trunks would then converge and fuse to form a ganglion impar, right? And the ganglion impar, remember, there are going to be ganglia that are associated with the sacral vertebra, but be 4 to 5, right? Then you still have the gray rami communicantes, which communicate to the ventral rami of the sacral and the coccygeal nerves. Then sympathetic fibers will be able to exit, right? Then the sacral splanchnic nerves are also going to be present. But what I want you to get mostly is the inferior hypogastric plexus, right? So I'll skip this one. When I talked about this, the ganglion impar, then you have 4 ganglia. Then that's basically the sacral sympathetic trunk, still the same concept, paravertebral ganglia. But there's what is known as the inferior hypogastric plexus, right? You have 2, a left and a right, which are situated on the sides of the rectum, right? Each plexus is composed of sympathetic and parasympathetic, right? And it receives postganglionic sympathetic fibers from the superior hypogastric plexus and preganglionic parasympathetic fibers from the pelvic splanchnic nerves. They will form the rectal plexus, it will form a prostatic plexus, it will also form the uterine plexus, as well as the vaginal plexus, right? Remember the pelvic splanchnic nerves, we say they are parasympathetic. They'll be coming from S2 to S4, and they'll feed into the inferior hypogastric plexus. In females, it will innervate the urethra, the rectum, as well as producing the uterovaginal plexus for the uterus, the vagina, and the ovaries, right? So that's just about it. Thank you.